appearance of the fundus? It is splashed tomato appearance. So my next question is, where do you see splashed tomato appearance? Very good. You see it in CRVO. What is the full form of CRVO? Central retinal vein occlusion. Now quickly tell me, what is CRVO? It is the blockage of central retinal vein. This usually happens in people, in elderly patients who have got uncontrolled hypertension, who have got diabetes mellitus, or glaucoma. So these are the risk factors of CRVO. You know how CRVO presents? What is the presentation? He or she is going to come to you with a sudden, painless, what is it? Sudden, painless, unilateral loss of vision. Important. Now, this condition we usually see, most common reason is, okay, so the most common reason you can say it is diabetic retinopathy. Now, another question, in CRVO, what is the most common complication that the patient will have? It is called as Fmge. Write it down, neovascular glaucoma. Neovascular glaucoma, it is otherwise called as 100-day glaucoma. So I'm going at a little speed because I assume that we have done a revision. So all these are your revision points. Okay, I'm not going in detail. So complication of CRVO, that is Fmge, that is neovascular glaucoma, which is otherwise called as 100-day glaucoma. Now, what is the treatment in CRVO? You're going to give intravitreal anti-VEGF injections, like example ranibizumab. You're going to give pan-retinal. So after that, you can try pan-retinal photocoagulation for treating neovascularization. Now, this again is an image-based question. Tell me, what is your diagnosis? What is it? It is exudative retinal detachment. Now, what is this exudative retinal detachment? It means that the retina has got neurosensory retina and retinal pigment epithelium, right? These are the two, broadly if I say, two layers of retina. These are the neurosensory retina and the retinal pigment epithelium. Now, when the neurosensory retina, it separates from the retinal pigment epithelium layer, because of fluid accumulation in between them, this causes a retinal detachment. You just have to know that in exudative retinal detachment, there is no tear. But a tear undagunnilla. There is no pulling, there is no traction here, no tear occurring. It is just that fluid is getting accumulated between the two major layers of the retina, that is neurosensory retina and retinal pigment epithelium. Because of this fluid accumulation beneath the retina, okay, so there is fluid accumulation between the neurosensory retina and the retinal pigment epithelium, and because of this, the neurosensory retina, it gets lifted up by the fluid. The neurosensory retina, what happens? It gets lifted up by the fluid. So this causes the condition that is retinal detachment, exudative retinal detachment. Now another question to you is, what is the characteristic sign that you see in exudative retinal detachment? Tell me. It is shifting fluid sign. Now you tell me, what is shifting fluid sign? It means that I told you there is fluid accumulation, right, between the two layers of the retina. So when the patient's head position changes, when the patient's head position changes, the fluid, the subretinal fluid, will also move. So that is called as shifting fluid sign. In which type of retinal detachment do we see it? We see it in exudative retinal detachment. Very important. Now question to you, identify this. This is also retinal detachment only. What kind of retinal detachment it is? Okay, so from here, this picture, you will make an R out of this picture. Usually this same picture ആണ് അവർ തരിക. Okay, so this is called as rhegmatogenous retinal detachment. Rhegmatogenous retinal detachment. Now what do you mean by it? See, regma എന്ന് പറഞ്ഞാൽ regma means a tear or a break, that is the meaning. Okay, so here the retinal detachment is occurring because of the retinal tear. And also remember, it is the most common type of retinal detachment, rhegmatogenous retinal detachment, very important for your upcoming exams. First point, here there is, you can see the tear, right? You also can appreciate the tear here. The most common type of retinal detachment, that is rhegmatogenous RD. Now here what exactly happens here? See, normally, okay, the neurosensory retina, it is attached to the retinal pigment epithelium. This violet or this purple color, that's not violet, right? It is purple. So this layer that I have drawn, it is retinal pigment epithelium. Okay, these two layers broadly, these two are the layers of retina. Now when the neurosensory retina, when there is a retinal tear, what happens? A break is formed in the retina, and the vitreous can, suppose let us say a break, let me take suppose there is a break happening in the retina. So what happens, the vitreous can sweep in through this break, okay, and the vitreous humor can get accumulated between the neurosensory retina and the retinal pigment epithelium. Okay, therefore this neurosensory retina can get lifted off the retinal pigment epithelium. Okay, so that is how the retinal detachment occurs. See, this concept you will understand only if you know the layers of the eyeball. I assume that you know it. Only then this, whatever I said just now, will make sense. Otherwise, just remember, rhegmatogenous retinal detachment, there is actually a tear happening. That is all you have to know. Now, can you tell me the risk factors, like in which all people can we expect rhegmatogenous RD? Yes, in people with high myopia. In people with high myopia, with increasing age, if the person has got ocular trauma or a previous cataract surgery, all these are risk factors of rhegmatogenous RD. Now, what are the clinical features of rhegmatogenous RD? The person is going to have photopsia. What do you mean by photopsia? Photopsia means flashes of light. Flashes of light. He is going to see floaters. Floaters in Arthandana. When the patient can see black spots, okay, or he can see flies. Actually, flies and develop, but he can see black spots or flies-like components in the air. So that is floaters. Now, a classic symptom that they're going to tell you is, they are going to come to you and say, Dr. G, I felt like a curtain was falling over my vision. A curtain was falling over my vision and my vision got lost. That is what the patient is going to come and tell you. So, see why this happens, because the detached retina, once the retina gets detached, it cannot perceive the light properly. But depending upon where the tear is, our area corresponding region first visual loss, adinishesham it spreads. Okay, so it gives the sensation of a curtain moving across the field of vision and completely losing his vision. Curtain, this is a sign that they are going to give you in your question also. The patient complains of curtain falling over the vision, such a kind of vision loss. So in that itself will give you the clue that it is a case of rhegmatogenous RD. What is the treatment? Okay, just one line treatment is enough. You don't have to know more about it. The treatment is scleral buckling, right? It is a classical treatment of rhegmatogenous RD, scleral buckling. What we do here is, a silicone band, we stitch it into the outer surface of the sclera. So this buckle, it pushes the sclera towards the retinal tear and it will help to close the retinal tear, right? So just know the name. What is the treatment? Scleral buckling. അപ്പോൾ ഈ റെറ്റിനൽ ടെയർ നിങ്ങൾ കാണുന്നത് ഈ റെഗ്മാറ്റോജീനസ് RDയിൽ മാത്രമാണ്. യു ഡു നോട്ട് സീ ഇറ്റ് ഇൻ കേസ് ഓഫ് എക്സുഡേറ്റീവ് റെറ്റിനൽ ഡിറ്റാച്ച്മെൻറ്റ്. യു ഡു നോട്ട് സീ ഇറ്റ് ഇൻ കേസ് ഓഫ് ട്രാക്ഷണൽ റെറ്റിനൽ ഡിറ്റാച്ച്മെൻറ്റ്. അപ്പോൾ ഈ 3 റെറ്റിനൽ ഡിറ്റാച്ച്മെൻ്റ് ആണ് നിങ്ങൾക്കുള്ളത് പഠിക്കാൻ. റെഗ്മാറ്റോജീനസ്, എക്സുഡേറ്റീവ്, ട്രാക്ഷണൽ. ജസ്റ്റ് റിമെമ്പർ, ടെയർ കാണുന്നത് എവിടെയാണ്? ടെയർ ഇസ് പ്രസൻറ്റ് ഇൻ റെഗ്മാറ്റോജീനസ് RD. ദാറ്റ് ഈസ് ഓൾ യു ഷുഡ് നോ. പിന്നെ another important point, we just learned it in exudative retinal detachment, you get to see shifting fluid sign, right? Shifting fluid sign. അതപ്പോൾ എങ്ങനെ ചിലപ്പോൾ കൺഫ്യൂഷൻ വരാൻ സാധ്യതയുണ്ട്. അതുകൊണ്ട് ഞാനൊരു കോഡ് പറഞ്ഞു തരാം. യു വിൽ ഷിഫ്റ്റ്, ഓക്കെ, യു വിൽ ഷിഫ്റ്റ് ഫ്രം യുവർ എക്സ്. Okay, he or she became your ex for a reason, right? So you will shift the place you're staying or whatever, shift the thoughts, whatever, from the ex.